Conception Channel podcast.
Hello, everyone, and welcome to the Conception Channel podcast, brought to you by the Being Fertile program in Yin Still Reproductive Wellness. I am your host, Spence PENTLAND, and today I'm super excited to be able to speak with our special guest, Lee Hullender Rubin. Welcome to the show today.
Thank you so much for having me.
Awesome. I'm super excited. We go back somewhat and have been colleagues for a long time, but Lee is here today to help us better understand research and in regards to IVF and acupuncture, or more accurately, what we just discussed before pressing record was the research with IVF and Chinese medicine, which acupuncture is a part of. And that's right. Language I think we all want to change because, acupuncture is much more than just the insertion of needles into points. And Lee is has been building the Trojan horse to try and create change in that respect. And I'm super honored to have someone so dedicated in our industry, which would be Chinese medicine too, that is so committed to helping everyone better understand what Chinese medicine is doing for them and how it can benefit them on their journey to babies, basically.
Gosh, right. Thanks so much. That was so kind.
Well, that's my intro. And as we also discussed beforehand, usually when I have a guest on the show, they send in a little form. So I've got their professional profile and achievements and experience, etc. And often I can summarize that, and that goes in the intro that I give. And sometimes when it's longer, I'll just read it. But with Lee's, it's too long for either of those. So what we've decided in tradition of it'll all be in the show notes. I mean, she is extremely decorated and has clearly dedicated her life to, furthering her education and a lot of other people's education in the academic world and clinical world as well for acupuncture. And so what we're going to do in tradition of the show is just dive back into your story. She agreed to kind of give us a little bit of a background, and you're going to want to, if you're trying to get pregnant or maintain a pregnancy and are considering IVF, Lee is the person that you want to listen to, so you can best understand what some of these adjuvant therapies, in particular acupuncture, can do, and Chinese medicine can do to help you on your to be successful. And so without further ado, Lee, welcome, and can you give people a bit of your background so I don't fumble around and do it an injustice?
You're so kind. Thanks again for inviting me, Spence. We do go back many years, actually. I think I met you in at a conference or a session for training in like 2004.
Was it? Yeah.
In Vancouver. Yeah.
Cool.
When an Australian researcher, clinician came and taught in Vancouver, I think.
Right.
So, I'm just like you in many ways. I'm a clinician. I became a clinician as an acupuncturist and an herbalist and Chinese medicine professional, or I guess some people also say East Asian medicine to be a little more region non-specific. Mm-hmm. I really chose to specialize in reproductive medicine just because it was just so deeply fascinating, and there was some new research coming out that made it very exciting. Mm. So when I was in grad school in Seattle, which is where I really started out, I took a special class, and it like just sort of ignited the fire of cool. Like, oh, this is so cool, women's health, getting pregnant, helping them get pregnant. And I found someone to mentor me, and then once we started working together, I just kind of like took the ball and ran with it. I was very fascinated with the fact that in Chinese medicine, as well as in reproductive medicine, you have a really clear outcome. Yeah. Are you pregnant? Are you not pregnant? Mm-hmm. Do you have a baby? Do you not have a baby? Yeah. It's a yes or a no, right?
Yeah.
It's a really, there's not a little bit. You
no
know,
subjective.
You can't,
Yeah.
So it's pretty black and white. There's no gray areas. With pain, though, you know, you've got a scale, and there's a lot of there's a lot of movement in that. I think that's very appealing to me about, you know, because it's neat in many ways. It's very again, no gray area.
Yeah.
So I had originally started, you know, practicing, and as I said, was mentored by this wonderful woman named Christina Jackson in Issaquah, Washington, and I started on a research study in the Seattle area, and it was one of the first studies that was actually kind of not positive, actually.
Okay.
And a fellow at the University of Washington had invited myself and another colleague of mine to be the acupuncturist on that study, and we did day of embryo transfer acupuncture. It's where you give people acupuncture on the day that the embryos are placed back into her womb. And we did it at our clinic in downtown Seattle. And the women would come from the fertility clinic, you know, which was like just not, it wasn't very far. It was a couple miles, but our clinic was right downtown. It was like in the hubbub of parking, and and they had never been there before.
Right.
And if anyone who's listening today knows, that is a very stressful day.
It's
and to have to go somewhere new, and you've never been there before, I think it's kind of, I think that may have negated any benefit that we might have had for those patients, because when we got to the results of the paper, we found that there was no difference between the women. Actually, there was a difference. The women who did not have acupuncture had a higher pregnancy rate than the women who did not have acupuncture. I didn't say that right. I'm so sorry. The women who did not have acupuncture had the higher pregnancy rate. The people who did had the lower pregnancy rate.
The unexpected result,
Yeah. So I'm noticing my headphones aren't working, so I'm just gonna turn them off and speak to you like this.
Okay. Yeah.
So that really lit a fire, because I was like, that's not what I'm seeing in the real world. Like, what is happening here? And so I had taken that protocol that we were using offsite to another IVF clinic, and I was doing it on site. And when results came out at a big research conference, there was lots of press. I was getting a lot of email.
Oh boy. Yeah.
Oh my God, how did this happen? You know, like that's the one thing about being a researcher, is one cannot be attached to the outcome, which is also a great lesson in trying to get pregnant, frankly. But ultimately, I just had to sit back and kind of like think about, well, what did happen here? What could be the contributing factors to understanding why did we get a negative outcome versus a positive outcome? That was really what started my deep interest in research, in addition to my already present and fascinating interest in reproductive medicine.
Yeah. Cool. So yeah, that would have lit a spark as well. I mean, it was Einstein, I think you said, as soon as you observe something or there's a bias of some sort, right? You obviously were stepping in with if it wasn't outwardly, inwardly, you know, a belief system at the very least, or a hope probably as well, that acupuncture would clearly help, because you've seen it clinically, and when it didn't, that would have lit a spark as well. And to date, really, is that, to be clear, is that one of the few studies that has had that negative impact or shown that negative result?
It is the only study that has had a negative result, and it's the only study where women were randomized into the one of two groups, and the acupuncture was performed off-site from the IVF center. Yeah. So when I looked back at our outcomes at the IVF center where I was doing it on-site, we actually saw it did not have a negative impact. In fact, it was about the same as the women who just didn't add it at all in women who had an IVF cycle with their own embryos that were fresh, never previously frozen. Because this was in the late 2000s, when frozen cycles weren't as popular as they are now.
Right. Yeah, there was a different style of, that was a question, because we'll get into, you know, your study that came out, this landmark study that I'm so excited about, that because it really embodies Chinese medicine as a whole, which it is, you know, that doesn't just include acupuncture. It's maybe herbal medicine, maybe dietary lifestyle recommendations, etc. It's a whole view of and an individualized protocol for or individualized treatment for each patient. But you, with the whole systems, or in 2015, that was right? Is that when that study came out? Okay, so you started working on that back when IVF techniques were a little different. So frozen embryo, the freezing technique was different than it is today, the vitrification, and a few things were different. I even remember, I think the PGD sometimes was maybe done day 3, and there was a few unique things. But as a whole, this is the first study that really was well powered, and that I'm going to help interpret what that means to people. I'm going to back up a second. In research, I think a dangerous aspect of research when it gets into the hands of media is pulling little snippets or media bites from conclusions or the discussion that can make big claims, and truly, unless you really understand, most aspects of what happened in a study, you should be cautious of what you're pulling from it. If you're just someone reading a newspaper headline or something, because there's so much that goes into it, and maybe Lee, you could touch on some of that, and then segue into why and how you set up the whole systems research. Well,
so I think you just touched on power, right?
Yeah, power. Sorry, I was going to get into it.
Right, exactly. So if you want to adequately power a study, you need what that really means is, like, do you have enough people in the study to truly detect a difference between groups?
Right.
Like, is it really fair to expect that a group of 10 compared to another group of 10, let's say this group A, has a 70% pregnancy rate and this one has a 30% pregnancy rate? That's not really generalizable to the greater population.
Right.
So adequately powering means that you have more people and you can draw a stronger conclusion if there is indeed a difference, or if there's no difference.
Right. Maybe a way to highlight that is if, the other end of the scale, if there were just 2 people in a study, and one of them got pregnant, that's a 50% success rate, but that's clearly not, going to represent the whole. Right. So as that gets larger and larger, it gets more accurately representative of what the world, would look like.
Right. So you're talking.
Okay.
No, you're totally right. Okay. But what you're also kind of talking about is validity.
Right.
So power helps ensure validity, but the second piece of that is that you have to make sure that people in both of the groups are equivalent as much as possible.
Right. Okay.
That they're not different, so that you haven't sort of shunted the positive people to be in your group that you want them to be positive, and making the people who won't get pregnant in your no intervention group. Right. That's a trick that sometimes happens in some research, which you really, if you're not careful, you wouldn't notice that.
Right. Of course.
So anyway, if we come back to what we were talking about with respect to the study that had the negative impact, because I just wanted to finish that thought.
Okay. And
that was, that first study that came out in 2007, we finally were able to publish a paper in 2014, and the acupuncture on the day of embryo transfer had a lower pregnancy rate than the people who didn't have it. That same protocol, which was provided on site at the clinic I was working with, there was no difference between groups. It did not harm anything, and in fact actually helped women who were having donor egg cycles. Mm-hmm. Were very similar, but that was smaller in number. Okay. So again, we're running into this issue of power, but it was a significant enough difference where we could at least say, okay, there's clearly a signal here, and if we could adequately power a study and look at it from a randomized control trial, we may be able to see something. I think the other thing that you can do from looking at using that protocol on the day of embryo transfer for donor cycles, you may be able to extrapolate that, because it's a very similar cycle type to frozen cycles.
Right.
And the success rates now with chromosomal screening are about equivocal with the donor cycles.
Donor cycles.
Yeah.
That's huge.
Right. So, I mean, it's a signal. It's something we could draw from to do future research. I would love to do that one day. Maybe,
Yeah.
hopefully, we will.
Yeah. Yeah.
But
Cool. Go Lee. Go Lee.
well, money, money, money.
Yeah. Yeah. Mm-hmm.
But my point ultimately is that we still have, we've got a ways to go.
Right.
And but that, even though that one study was negative, it wasn't the protocol. The protocol was not the problem. I really, because of that observational research that we did afterwards in the clinic where I was working, I think we could actually say it probably was a location.
Right.
It probably was a location of treatment on a day where it's very stressful, and those women had never been there before.
So the takeaway there, adding the stress of travel downtown Seattle, I've been there. And, on already a huge day, likely had an impact. And
yeah, we don't know, but it may have.
Yeah, but it highlighted, at least when compared to the same done on site, and that's the exact study why we recommend the on site, and why, the reproductive endocrinologists or IVF docs that we work with all understand that as well, and are so great, and it's happening more and more all over the world where acupuncturists are on site, and that's fantastic. And even though that was a negative impact, what's come from it is that exact understanding. It's huge. And what I understand and how I see it is, we're one of the only people sometimes when we're on site at an IVF clinic that is there strictly for the woman, not the embryos, and and is kind of, a support that is quite unique. So and it's an honor to be there on that day, and
it is. I share that feeling with you so much. I still do. Well, I just finished doing it. For the last 2.5 years, I was part of the Oregon Reproductive Medicine acupuncture team, doing the same thing. I was on site at least one day a week and once every 5 weeks on the weekend, providing the same type of treatment on the day of embryo transfer. And it's such an important day, and to have that and hold that space with them, where it's all about, let's bring this embryo to you and place it in your womb, and let's support implantation. Like, that's really our goal, and help you to be as relaxed as possible
and receptive. Okay, so the difficulty with studying acupuncture, and that's what mostly has been researched so far. Here's a protocol of acupuncture points. Does it help or not? Usually done on embryo transfer day. And, we're a holistic medicine. We individualize treatments. And so fitting acupuncture into randomized controlled trials is kind of like fitting a square peg into a round hole. People have tried to do it, and, largely there's at least been shown some benefit. They've tried to include sham, and which is a different or placebo effect, which is really easy with drug trials, but more difficult when, are you putting a needle in someone or not? It's kind of hard to placebo that. But anyway, that is why your study is so special. The whole systems that came out in 2015 in reproductive biomedicine, and because you compared 3 great groups, and literally can compare apples to oranges, which you should be able to do in research, and attempted to try and qualify and quantify the essence of how Chinese medicine is trying to help, and what it can do, and what its outcomes, how it may change outcomes. So what you've helped me set up our research spreadsheets years ago.
Oh yeah, that's right.
So I'm excited to, and we included Chinese medicine diagnostics over these years too, in that. So I'm excited someday you should get your help to kind of extrapolate. And but can you tell everybody who's listening, why you made the you wanted to step into that whole systems, traditional Chinese medicine, and how you ended up, the thought process of setting it up, to try to, bring light to how Chinese medicine as a whole helps more than maybe just acupuncture?
I think that's a great question. Ultimately, we're not just talking about one intervention of sticking needles in someone. When someone comes to us, we also help with diet.
Right.
We help with lifestyle.
Right.
we might suggest some specific nutritional supplements like a prenatal or vitamin D or something like that, maybe even fish oil.
Right.
If we think it's appropriate for that particular person, and not everybody's going to get everything.
Right. Yeah.
But that gets to be lots of little pieces. And so do you pick out each little piece and say, oh, well, does that work?
Right.
Or do you look at the global thing, the whole system of the intervention, which is the acupuncture, maybe even Chinese herbs, the lifestyle, the diet, and maybe kind of think of that as just one intervention. Right. Because in many ways, IVF is one intervention.
Right.
And while they have picked out each of the components to see which is the most effective in a group of other drugs,
right.
or alongside the other procedures, we don't have the luxury of being able to do that. I think the first step really was to say, okay, people are coming to my office. There's this idea of a whole system intervention, a whole systems research. I wanted to call it whole systems traditional Chinese medicine. It was not coined by me. It was coined by this fabulous researcher here. Actually, it was at Kaiser. Her name is oh my gosh, her name is escaping me at the moment. It doesn't matter. But anyway, she Rittenbaugh, Cheryl Rittenbaugh, and who was going to come to me. Yeah. So Cheryl coined the phrase, and they sort of like developed research that looked at different systems of medicine, like Chinese medicine versus naturopathic medicine versus your usual care, which is another whole system of medicine.
Right.
So for IVF, no one has looked at this. But what happens is people come to our practices and they get a much more comprehensive intervention rather than just acupuncture. We don't walk into the room like a robot, put in the same points, and walk out the room. Yeah. We talk to them. We get a really good sense of what are your individual needs. You know, what brought this endometriosis person here is probably very different from the next endometriosis person. And the same thing with the polycystic ovarian syndrome. This person might have more insulin resistance, whereas this person has just, irregular cycles and more cysts or something like that. So that these are very different presentations. The beauty of Chinese medicine is that we can actually use that information to help us develop our treatment plan.
Right. Right.
And then tailor it to the person. Well, you can't really capture that in a standardized protocol, can you?
Right.
Which is what you were just talking about a little bit ago. So this paper basically is all about looking at that global intervention, not separating out the ingredients, because I didn't want to overestimate one ingredient as being more powerful than another.
Right. I
wanted it to be the sum of all parts.
Right.
And so we compared that Chinese medicine to people who just came in on the day of embryo transfer.
Right.
And we compared that to just the people who just did IVF with no other interventions. Right. So those are our three groups.
Right. So, okay. Yeah. Thank you for the pause. I'm like, everybody seems okay. They'll walk into an office or Google or what is the success rate of IVF? And you said it perfectly, where and people should know, IVF, you come in, you see a physician, you get put through testing and diagnostics to find out what different interventions even within an IVF would work better or worse for your case. And largely in many respects, you would be individualized to some degree. I mean, obviously not holistically, but your treatment is going to be catered somewhat to you, and different drugs, different everything. The ingredients that you're talking about would have separate research, but people just want to know, how does IVF help? Will it help me, or what's its success rates? And so you're trying to just do the exact same thing with Chinese medicine, because no one that practices acupuncture or Chinese medicine would just walk in, put in points, walk out of the room, and that'd be it. They're emotional and spiritual support. They're recommending supplements or diet or whatever that person might need, and whatever maybe even the practitioner might be a little more adept at. And so, okay, so that's a great clarification. So a lot of the research had been done on just acupuncture on embryo transfer day, and there's plenty of IVF without any intervention. So you included this whole systems as a third arm in this study. So what did you end up seeing?
So when TCM was added to IVF, it was associated with a 93% increase in the odds of live birth compared to everyone else.
So live birth.
Live birth. So we went to the final outcome, which is delivering a baby,
Right.
not just getting pregnant. Because I think for me personally, I was more interested in live birth. So I didn't just want the clinical pregnancy rate, like the positive pregnancy rate at 6 weeks and 8 weeks, and the ongoing pregnancy that once they're released from care from the IVF center. I wanted a tangible outcome. So, well, they're all tangible outcomes. What I mean with the final outcome.
Well, that's what every woman wants.
Yes, exactly.
You know, so that's the only measure that really makes long-term sense, right?
Yeah, exactly. So we saw, like I said, Chinese medicine was associated. So when I say associated, that means that I'm talking about observational research. We did not randomize these women. We just looked back at 5 years of data and compared them because the groups sort of just naturally emerged. We had women who came to my clinic and got Chinese medicine. Yeah. We had the women who specifically requested day of embryo transfer acupuncture at the IVF center. And then we had clearly the data for the women who just did IVF without any other known intervention. Now, it is possible the women who didn't have any other known interventions could have gotten it somewhere else, and we just don't know.
Right. It wasn't reported. Yeah.
Yeah, no, it wasn't reported. So that could mean that we may have underestimated or overestimated. We don't know. So, but that's the beauty of observational research. You can kind of at least get some basic information from there you can then inform randomized controlled trials.
Right,
okay.
Right.
So let's go back to TCM and its influence on outcomes in this particular cohort. So these are women that went through IVF from 2005 to 2010. We just said that TCM compared to everyone was associated with a 93% increase in the odds of live birth. That's it's almost a twofold increase.
Right.
If I just compared Chinese medicine to women who just did IVF, and those were the only two groups that I was looking at, they were associated, the TCM people were associated with 109% increase, or definitely a twofold increase in the odds of live birth. So we've essentially, they were associated with doubling the chance of getting pregnant. Right. And then when TCM was just compared to that day of embryo transfer acupuncture,
right.
The TCM people had an increased odds of live birth of 62%. So we still had a substantial increase. It wasn't twofold, but it was 62%, which is still very, very good. Mm-hmm. And those were within women that had an IVF with their own eggs.
Okay, and fresh, right?
Yes, they were all fresh. Yeah. Mm-hmm. And there was a lot of women. There was like over 1,000 women in the whole study. There were 119 in the TCM group, 580 who just did IVF alone, and 370 who did acupuncture on the day of embryo transfer. So we, as you were saying earlier, had a lot of people. We were adequately powered. Yeah.
That is fantastic.
Yeah, definitely.
So, okay, and I remember reading something else. You know, you said some of the people in the just acupuncture or in the just IVF group may have had complementary or some sort of wellness and health interventions as well, just not reported to their physician. So how could you ever know? So that would work. That would be in favor of whole systems, Chinese medicine's outcome as well. But also, I think I remember you stating in your study that the average age in the TCM or the Chinese medicine whole systems group was higher, and the diminished ovarian reserve rates were also higher. Is that correct?
Yes, that's true. It wasn't actually that much higher for age. There was no difference between the groups. I'm looking at it right now.
Okay.
There was no difference in the groups between age. At the time, FSH was the big predictor of outcome. Right. Now we use AMH, as you know, but FSH at that time was the big one. So there wasn't a big difference between them. The thing that was different between the groups, and we accounted for this in our analysis to make sure that it didn't have this really huge influence on the analysis, but the diagnosis of diminished ovarian reserve was higher. They had a 31.1% incidence of diminished ovarian reserve in the TCM group, whereas there was only 20% in the usual care, or the IVF alone, and 21% in the acupuncture group. The other thing that was different that's, I think, really important to notice is the whether they had failed a cycle before. Okay. So there were more women who had failed a cycle in the TCM group. So and we know this in practice anyway, that we usually see people who have failed many times and they're just like, I just want to get pregnant. I'm going to do everything I possibly can, make my diet better, make my life better, just make me feel better, let me get pregnant.
Yeah.
So we had to account for that in the analysis as well. And we did. I did this specific type of analysis, which is called multivariate logistic regression.
Okay.
I'm not going to go into all the details of it, but just suffice it to say, actually, when you have variables like this, differences in characteristics of people, you can use that as a variable to address its influence on the outcomes.
Right. To get more accurate with the information that's spit out. Right. Okay. So if I remember correctly, there's been some other research that points to Chinese medicine, or probably more accurately, acupuncture, helping more in groups with diminished ovarian reserve. Was that Magarelli? I forget. This was early on. Am I right in saying that? So it might be kind of.
I think you are right. I think that he looked at, what were the characteristics of women who best respond to IVF, and I actually did a secondary analysis on this same cohort, kind of asking the same question. Okay. He first looked at age, and then he looked at diagnoses, right. And so I've looked at age as well. He found that it was roughly the 37 to 40-year-old women, right. that benefited the most, and I found a similar outcome when they added traditional Chinese medicine. The women who were aged 35 to from 38 to 42 got the most benefit. Right. So they were associated with more live births compared to the other groups. Right.
And this is live birth. I need to yes. reiterate that, because that is a baby. And, because you go, at the Canadian Fertility and Andrology Society, it's the equivalent to the ASRM in the US. It's an annual conference where medical specialists get together and discuss fertility and andrology, and different presentations. Anyway, there was a debate, and I ended up getting to chat with one of the guys. He was from the Netherlands, I believe. Brilliant. I'd be terrified to ever be toe-to-toe in any discussion with him. But brilliant mind. And he, we were having lunch, and he talked a lot about statistics and how, live birth is really the only statistic that matters, because it's the only statistic that matters to the patient, and anything else is irrelevant, and should only ever be, well, not irrelevant, but should only ever be used as clinical data for the most part to understand how to better practice and treat, and too often clinical pregnancy rates are used to display effectiveness of a lot of clinics. There's just to the public, IVF clinics, and it can be quite misleading when actually you have no idea what the live birth rate is, and that is truly what matters. So thank you for that being your endpoint, in your study, because that is what matters. But so something about whole systems, the major difference between whole systems and women that come in and say, well, I heard acupuncture helps on embryo transfer day. Can I have someone meet me on site? Right. Is that there is a time between, when a woman starts, and man, maybe we'll touch on that too, starts, diving into maybe a wellness and health plan for themselves with the practitioner of Chinese medicine. Between then and when they start, stimulating their eggs and having egg retrieval and embryo transfer. And so what, there's been a few studies looking at that ideal time and treatments, and it can, sometimes people come for 3-4 treatments beforehand, and others, maybe an example would be polycystic ovarian syndrome. Sometimes, a dose of 24 acupuncture treatments with some time to help re-regulate, insulin resistance and a few things is important. So can you touch on what kind of the range and what was found and included in the study? Or
so I think I understand your question.
I don't understand my question.
No, I think you're asking about dose.
Dose.
And this is a really good question, because I think we have this expectation that 2 acupuncture treatments on the day of embryo transfer are going to magically make everyone pregnant.
Right.
And that's just not the case, especially as IVF centers are getting better and better at their jobs. It does have a benefit of at least, helping support someone be more supported and less stressed and more receptive on that day. But as far as like improving pregnancy rates, just the day of embryo transfer as an intervention is likely not enough. And that the more accurate intervention should be something a little more comprehensive, like I talked about in my Chinese medicine, my whole systems Chinese medicine paper. Something like 12 sessions for a non-donor cycle, a woman who's using her own eggs, 11 or so with the frozen or donor cycles.
Right.
So dose is something that we haven't really nailed down yet, though. This is just a suggestion based on the literature. And this last paper that I wrote in Acupuncture and Medicine was really kind of like getting to that. Like, we can't just assume 2 treatments are going to be enough. And so part of our education to patients and part of our education to providers is that, look, we have to be thinking about a more comprehensive intervention, one that can actually provide the benefit that we think it can.
Right.
If we go back to your question of dose, what is the adequate dose? It depends on many different factors, like what is the diagnosis of the patient. So in some of the research that you just referenced, where there was 24 sessions, was polycystic ovarian syndrome, and that work is really, really good on establishing the fact that when acupuncture, electroacupuncture specifically, was compared to exercise, it was at least as good as or better to improve androgen levels that were elevated, improving insulin sensitivity, to reducing really high AMH. So really high AMH is not good. Really low AMH is not good. It has to be, like Goldilocks, just right. So, so it helped to normalize that. So that type of research is called comparative effectiveness research. You also touched upon earlier about the statement of trying to compare acupuncture to a placebo, and we actually can't do that. We don't fully understand the mechanisms of acupuncture yet to be able to say definitively we can account for all of those, and this is truly a placebo, that it actually has no physiological effect at all. But what we can do, and there's a lot of research that's coming out now where we're like, okay, well, we think acupuncture has a benefit, so let's compare it to something that does have a benefit. So let's take acupuncture and compare it to exercise for the polycystic ovarian syndrome people. And it did just as good or better on those outcomes. Now, I will say that, and that was 24 visits, by the way. So another study that was done by that group, they started with 8 sessions to look at blood flow to the uterus. Does it actually increase it? Yes, it did, with 8 sessions. So again, that's not 2 on the same day. It was 8 sessions over 4 weeks. There, in another polycystic ovarian syndrome study, it was twice a week for 8 weeks for 16 total sessions, and they compared that to, I believe, also exercise, but don't quote me on that. It was not a placebo acupuncture. And they looked at other parameters on polycystic ovarian syndrome patients that I actually can't remember off the top of my head. It's probably in this paper here that I'm trying to scroll through at the same time.
At the same time as you're speaking to the audience, multitasking.
Yes, I am multitasking. So I will say this, that in my paper, 11 acupuncture treatments during an IVF cycle was associated with significantly improved IVF birth outcomes and fewer miscarriages. And that's something we actually haven't talked about. Not miscarriages, fewer biochemical pregnancies. So in the TCM paper, what we found was that if someone got pregnant, they likely stayed pregnant. They had fewer implantation failures. Fewer biochemical pregnancal and significantly, like a 75% reduction in the odds of having a biochemical pregnancy. So if they were positive, most likely they stayed pregnant. They had fewer miscarriages. It just wasn't statistically significant. It was clinically relevant, though. So I think we don't know what the optimal protocol is, but ultimately, I think we as a community have to be thinking about how to articulate how many sessions do we really need? And I think a baseline to start, just based on this literature that I did, was roughly 11 to 12.
Right. And
transfer.
Clinically, and this isn't documented, this is just our own internal, reviews why we keep statistics to try and find out how we're doing. Ultimately, that's what it should be about. We're somewhere in that same vicinity, about the average, with people that were successful. The last time we pulled data was about 2.5 or about 11 to 12 treatments in about 2.5 month period of time. These are all averages, and we're not all stats, but some people, require a bit more, than others, and that should be a discussion with you and your practitioner, and hopefully someone who does have some experience, treating reproductive health and supporting women going through IVF, because they'll have a better grasp on that. And so, okay, before we just hop into your other studies that I had no idea, that you've touched on already, but what did the male side factor in any way, or was it a variable that was left, and maybe that would even improve things more? That's my belief.
I know you're very interested in male fertility. I wish I could say that yes, we treated a lot of men, but we didn't. I mean, as you probably, I don't know what it's like in Canada, but I can tell you, when I was practicing in Seattle, it was really difficult to get the men to come in to have practice or to receive treatment. Same for you?
Canada is not unique there at all.
Great. No. So then Seattle and Canada are comparable in that respect.
Yeah.
What I do know is that of the 3 groups that were in the study, male factor was an issue in 40% of the TCM cycles, 36 in the IVF alone cycles, and 35% of the acupuncture only cycles. So they were comparable. So it was pretty evenly distributed between the 3 groups. So that's good.
Yeah.
We, if that was different, we would have used that as one of our little variables in our analysis. So, did we treat enough males to actually be able to say anything? No. I wasn't able to include them. It was really all about the women.
Yeah, I understand, and that's common everywhere. I mean, that's always how could we improve success rates? Work with men. That would be.
I agree, and I think ultimately, as that the statistics, not that I've done, but just out there, are that male fertility is declining, and we have to figure out ways to help preserve it. I think Chinese medicine has something to really offer here, but we need to verify that, which is part of the reason why I became a researcher. Is I see what's happening, but I want to verify it.
Yeah. I thank you for appeasing me with the male side. I just feel like that is so. It's hard to get men in. They don't always have to get needles. I get it. They're terrified of needles. Rather take a bullet. But we can look at herbs, diet, lifestyle things. Some men have never had a conversation with anyone about not wearing synthetic underwear in synthetic pants, sitting on like a synthetic chair all day at the office, and cooking their balls, right?
Right, exactly.
Exactly. Heat, the number one enemy of sperm. But anyway, I digress. Something more recent. Last year, you talked about age. Does age matter? And you got that published in Fertility and Sterility. Congratulations. What was the discussion about on that paper?
So it was just an abstract. I presented it at the annual Congress of the American Society for Reproductive Medicine, similar to the Canadian Society one you were just talking about. And I just presented it this past fall. And so it's 2018, 2017. I've forgotten what year it is. It all blurs together.
You're busy.
So what we really found is that there's a trend towards a significant difference in live births in women aged 38 to 40 compared with all cycles, and that was statistically significant, and a clinically relevant difference in the women that were under 35 and aged 35 to 7 when TCM was compared to the other groups. Now, it wasn't statistically significant, but I can send you the actual abstract so you can post it for everyone to see.
That would be great, yeah. It'll be in the show notes down below you.
Yes.
Yeah.
Research ease. So if people have questions, they can email me, and I'm happy to discuss it with them. And I'll give you my email as well. So, but
the conclusion, the takeaway.
The main thing is that age is likely a consideration. Women under 35 typically will do fine. They'll do pretty okay without adding Chinese medicine. It'll benefit them in other ways. It may not actually improve their live birth rate, but it could actually help them be more resilient during this very stressful process. One of the biggest reasons why people stop doing IVF, it's been very clearly described in the literature, is that the stress is so overwhelming that people are just like, I can't do this.
Right.
So Chinese medicine has so much really good literature about stress reduction, helping being more resilient, helping support anxiety and depression. Yeah. All good things to help with women trying to have babies.
Got it.
And build their family.
Yeah.
So the other aspect here is that how I concluded this was that age may be a consideration when integrating acupuncture or Chinese medicine with IVF, and it could benefit the women aged 38 and older more significantly. So in my retrospective study, we found that when you added TCM to IVF, it was associated with an increased odds of live birth in women aged 38 to 42. So those were the women that really benefited the most, the 30 to 42-year-olds. And we know that that's kind of logical. Yeah. When you look at like the charts that look at how many eggs people have, we really start to see that decline from 37 to 40. Right. And 41 to 42, it's a very steep decline. Yeah. Chinese medicine may, and we don't know this for sure, but we may be able to improve the dynamic between the ovaries, the pituitary, and the hypothalamus so that they work more efficiently. We may be having an impact on blood flow, which then could have a primary impact on its physiology in that way. We may be having an impact on the neurotransmitters that then tell the deep brain to release all of the things that tell the pituitary to release the things to tell the ovaries what to do.
Right.
As well as just helping people to feel less stressed. We definitely know Chinese medicine, specifically acupuncture, helps patients release more endogenous opioids, which helps them to relax. Right. So, this paper is a small paper because I had to differentiate by groups. So we're talking about power. Yeah. This particular paper is a little less adequately powered in my estimation. So I would say that the small numbers in the groups limit the strength of our observations, but it's still another signal that's similar to someone else's work, Dr. Mayorelli's work, where women aged 38 and older responded better to adding acupuncture to their cycles. Yeah,
so that's the takeaway. Yeah, if and that is the population that more often would seek out. I understand time, and therefore I am going to pull out all the stops, and sometimes, at least clinically, what I see is let's not pull out too many. Let's not make, I call it hyper wellness becomes a stressor. But so that's a fully different conversation. But so from here forward, where are you're probably, you haven't retired, right, from research? So what's next? What kind of direction or what kind of understanding or further information are you trying to extrapolate from your research?
Well, I think the next thing that I am planning is, I'm relocating to San Francisco. I'm taking a position at a research institution. I will be a clinician still, first and foremost. That's my love, and I don't think you can be a good researcher without actually being a clinician if you're talking about medicine.
Right.
But I would like to describe the characteristics of the intervention of Chinese medicine a little more clearly. So my next paper will be fully fleshing out this abstract that I presented, in addition to talking about the characteristics, and probably adding in a little bit more about diagnosis and looking at perhaps who responded better based on biomedical diagnosis. Right. I don't have Chinese medicine. And then I also have another research interest, which is in female sexual pain.
Okay.
I just finished a pilot study on that, so I'm writing that paper. I'm in the middle of writing that paper, in the middle of moving, in the middle of, relocating.
Yeah. Okay. Well,
all the things.
It'll keep your mind occupied while you're packing boxes. That's interesting you touch on that, and I'd love to just, off the podcast chat about, I've really been integrating pelvic floor physiotherapy into more of my cases, and that being something actually that I postulate an early observation of clinically of younger, more unexplained cases, it being a benefit where there's. Anyway, I can go deeper into why I think that, but it's not research, and that's not why we're here today with Lee. These are my thoughts, but maybe we can correlate and chat more too about our clinical research with the Chinese medicine diagnostics that we have and pull and chat, because I'd love to be able to, because one last thing with research is once you've got it done, that's great. But when someone else kind of, like you said, kept talking about, we kind of pulling the same conclusions as another study, when more studies draw similar conclusions, it also, gives it more validity, correct?
Yeah, so you're building the evidence to help say, is there a there?
Yeah.
Ideally, we would prefer to have research that is all randomized control trials, but as I said earlier, it's really challenging for us to do that. That is the gold standard, a randomized control trial, and so as time goes on, we'll try to do more trials that compare acupuncture to, say, mind-body programs, right, or cognitive behavioral therapy, that sort of thing.
Right. Okay. Yeah. In how it's always nice to pair with IVF because it's a protocol and there's a clear start and end date to it. But so thank you so much, Lee. Some of the takeaways, are for me are that, the whole system's helped with live birth in a well-powered study that you did. Thank you so much for doing that. We touched on dose, which is acupuncture isn't magic, and health and wellness doesn't happen overnight either. Be realistic with, how you're stepping in. And we didn't even go into miscarriage, and maybe we could another time. Male factor, again, maybe a really, that's one of my pearls, maybe something really beneficial to work with some. And, to just bottom line, get people to start thinking about Chinese medicine as a whole versus just acupuncture, and working with someone that you trust that has, some experience to. If you're prepping for an IVF, it's so important to be holistically ready for it, it's not essential, but I've seen so many women go through it as you have, thousands, now, and even nurses at local clinics, have admittedly said verbatim that we can almost pick out in the waiting room acupuncture patients versus non.
Well, yeah,
it's great, right?
Yeah.
And so if you can step through something, it's not going to take away the stress of it, but it might, mediate how your body and your psyche will deal with it, and the reactions to it. But anyway, thank you so much. How can people learn more, get a hold of you? We'll put some links in the show notes.
Yeah, so since I'm in transition, the best thing is you can find me just email actually is probably the best. So it's drlhrubin@me.com. I'll give you the
I'll put it in the show notes too. Yeah. Sure.
Wonderful.
Great.
Yeah,
Awesome.
Thank you.
Yes, excellent. Well, good luck with your move to San Francisco. I'm excited. Someone else to visit in such a great city. Not that Portland isn't amazing as well. I'm sure you'll be sad to leave. But if you have any questions, ask Lee. And I hope this kind of clarified a little bit. That was my intention. It's hard to take off the clinician hat and translate research, into terminology that is really relevant. And also, if there's a physician or two watching, so they pulled something from this too. I know we're always dancing between that, but thank you so much, Lee. You're doing so much great work, and it's so appreciated.
Thank you. It was such a pleasure to be here. Thanks for having me on, Spence.
All right. Take care.